Hi, everybody, and welcome to the June edition of the Research Roundtable. I am Brenda Viola for Lympha Press, and on most months, Dr. Karen Herbst, who is the Lympha Press Chief Medical Officer, interviews thought leaders about their latest research. But tonight, and appropriately for Lipedema Awareness Month, the spotlight is on her own research. And joining us at the table tonight is our amazing research team and a representative from LymphoPress. Now, before we get to the introductions, and we're going to have everybody introduce themselves so you know who's sitting around the table tonight, I'm going to do just a quick overview of this published paper. And I'm putting a link to this article in chat so that you can click that link and know exactly the research that we are talking about. And by the way, let us know you're here in chat. Let us know where you're logging on from. And as is always, we want to hear from you. Put your questions in the Q&A and we will weave them in. Dr. Herbst, when she is done walking us through this paper, she will get to the Q&A as soon as she possibly can. But this focus tonight is on a groundbreaking study that was just published in Life, which was April 2025, I believe, is when it was published. It investigates the effects of an advanced pneumatic compression device on women with stage 2 to stage 3 lipedema, independent of other therapies. The findings reveal that in-home use of the advanced pneumatic compression therapy device significantly reduced leg volume, adipose tissue thickness, and fluid accumulation. This is all really good news for your patients, for clinicians, everybody logging on, such good information. But how did we get to those findings? How do we connect the dots from what was revealed and the methods used and all of that good information, which is my cue to disappear? But we're going to do some quick introductions, and I'll start with you, Dr. Herbst, of course, because you are our anchor.
Hi, everybody. Happy Lipedema Awareness Month. Wow, we're like at the top of the month. I'm sure it's going to be an exciting month all around the world. But tonight we are going to share a paper that everybody on this panel was involved in. And it was a dream to write a research paper with Dr. Lindy McHutchison and Dr. Carlos Alfonso Zelaya, and also Marianne Sommerville, welcome. And then Tatiana Zimmerman, who's not here, because they're a dream team. And I'm going to let them go ahead and introduce themselves, but you'll find out when you see this paper why they are a dream team for research. So go ahead, Lindy, why don't you start?
Well, hi, thank you, Karen. I'm Lindy McHutchison, and I am a vein doctor, and I'm also an OBGYN, but I'm mainly veins. And I am at Carolina Vein Center, which is actually now part of the Center for Vein Restoration in Durham, North Carolina.
Awesome. Carlos?
Hello, everyone. Greetings. My name is Carlos Zelaya. First of all, I'm sending my best wishes to you all. Thank you so much for being in here. The magic of internet. Okay, good morning, good afternoon, good evening, wherever you are. I'm from Honduras. I graduated as a physician in Honduras. Now I live in North Carolina, where I have this great opportunity to meet Dr. Lindy McHutchison, and we started working with lipedema, and we got this wonderful study that we work on, and we're happy to share with you all of our great outcomes that we have. So thanks again, okay, for being in here, and we hope that we're gonna have fun and we're gonna learn a lot.
Thank you. Marianne?
Hi, I'm Marianne Sommerville. And yes, I was an OBGYN back with Lindy in residency at LA County. Did that until only a few years ago. And then Lindy and I stayed friends over the years, and I moved to work with her and learn how to do veins, which I was happy to do. I am excited that I was able to participate in the study. And so excited, sharing everybody's excitement for the publishing of it and how well it turned out. And it's just amazing. It's like a miracle. So for all the patients, I'm sure as the patients find out about the study, they're just so excited because something's being done. It's being researched, and it's probably the first of many studies to be done.
Thank you. And Deborah?
Yes, hi, everybody. I am Deborah Gross, and as you can see from the sign here, I'm getting my hands in the right position. I am the LymphoPress product specialist, and I live very close to Lindy's clinic, so I was there to help out with the equipment, and I am here today to help with any equipment-related questions because the LymphoPress was used in this study.
Thank you so much. So let's just start from the very beginning. And I'm going to ask you, Lindy, why did we decide to do this research protocol? What was the driver behind all the questions that we asked?
Well, I've been seeing lipedema patients in my clinic and diagnosing them since about 2016, and then I met you in 2018, and I started recommending the pump for the patients that we noted did have a lymphatic component or some dysfunction, and anecdotally, we were starting to see these patients have some really good outcomes. So over the years, as you and I would talk about it, we've been formulating this study, I don't even know how many years. Seems like it was around COVID where we started to really materialize it. But because I was seeing so many good results in my clinic for patients that I recommended it for, and I shared that with you, we sort of put this study together, and you designed it brilliantly, so that we could actually see and prove if what we were seeing in our clinics was actually what was happening.
And I feel like we all designed it together. I mean, I did an initial design, but everybody put their hand in there and we changed things for the better. And I just want to point out that I had nothing to do with the study, even though I was involved in writing it. You and your crew did the entire study separate. And then we all participated in writing this up. One of the things that you mentioned was that with pumps, people got good outcomes. And one of the big contentious questions, which probably still remains in some people's mind, is there edema in lipedema? Can you talk about what we did in this study that showed that there likely is edema in lipedema, and what was the outcome?
Yeah, absolutely. Well, there are so many aspects of this study. One was looking at edema. One, of course, was looking at the quality of life and the functional scales. And one was looking at symptoms. And when we did we used the SOSA device, which was a bioimpedance device that actually has a way of measuring intracellular and extracellular fluid. And we were able to use that device and also measuring some leg volumes to definitively show that we were actually mobilizing with the pneumatic pump both intracellular and extracellular fluid by looking at the bioimpedance data in the DEX score.
So what did you maybe I'll go to Carlos. Carlos, do you remember the outcomes for extracellular fluid and intracellular fluid?
Yes. I just wanna point out the, the good thing about this study is that that first of all, there's not much data about lipedema, and the studies that are out there sometimes they include another type of treatments or management. So whenever you include other management, you're not able to see um, the real result. Like for example, there were some studies who include besides the pump, they include MLDs, they include physical therapy. So with this pump, we were trying to be like more specific to the pump to see the good results. So that was something that basically like brought us like we wanted to see if really if the pump was making good results. And with
So
this,
can I just rephrase that for a sec? So basically what you're saying is that there are a lot of studies out there, but they combined like manual lymphatic drainage therapy, wrapping, and the pump, and maybe diet and exercise all at the same time versus sometimes nothing, right? But sometimes controls. So it was just too many modalities. And for this study, you all designed it so that we're really just looking at the pump, although all of the women in the study did wear compression garments.
that is correct. Yes, that is correct. Yes,
So
thank
tell
you.
me about the fluid.
So for fluid, we try to measure fluid in different ways. One was the 3D imaging, which basically that tells us the measurement of the legs. And we saw like good results with this. It was basically, we saw the reductions, especially on the left leg with patients who went in the on the treatment group. This was one of the first outcomes that we saw. Um, then with the bioimpedance, we were able like to see also a reductions in the intracellular and extracellular fluid, which basically tells us that fluid was being moved out of the legs on patients who were on the treatment group.
So one of the things that we spent a lot of time talking about in this paper is like, where is the fluid in lipedema? Because we know that when you do ultrasounds, you don't see free fluid hanging around in the lipedema tissue like you do in lymphedema, right? So I think the SOZA was very powerful in that it showed a reduction in extracellular fluid in the control group, which was probably driven by the compression garments that they were wearing, but it showed a decrease in extracellular fluid and intracellular fluid in the treatment group, suggesting that there was a greater amount of fluid reduction with the LymphaPress pump. Does everyone agree with that?
Mhm.
And that I think what we talked about in the discussion was this, super interesting osmotic flow of fluid, and that the pump has to drive sodium out of the cells and water comes with it. And from Shelley Krasinski's work, we know that there's excess sodium in the tissue of women with lipedema. So that connection's pretty exciting, that in order for fluid to flow, you need electrolytes to flow too. So
Yes, and that's what one of the things that we really came out with the results that patients they do really have an improvement whenever they wear the compressions, because all the patients who were on the control group had an improvement on the intracellular fluid, but the patients who were on the treatment who were the compression plus the pump have an improvement in the intracellular fluid and extracellular fluid. So basically, once we combine both, it's a better outcome. So
yeah.
that was a good observation that we had with this study.
And I think what we said was that the more fluid we moved out of the tissue, the longer the benefit would last. So you could wear compression, but when you take your compression off, the fluid comes right back. But maybe it will take a little bit longer for the fluid to come back after you've been pumping. But we only had a 3-month or a 1-month study. It was a 1-month study. That was it.
Yes,
So I think longer studies might show even greater benefit, right? And
absolutely.
then we talked about the fluid or the volume. You mentioned that, and the volume we did by 3D imaging, right? And I think it's so much better than the tape measure. Wouldn't you agree? Marianne, did you do any of the tape measurements or?
I didn't do the measurements.
Yeah.
So
Carlos, did you do any of the tape measurements?
Oh, yes. Basically, the tape measurement is legit. It's being used for many studies. The issue, or I mean, it's basically like when the patient comes in you can basically measure one side, but then after a month, when they come back, you can have like little. I mean, it's hard to measure in the same spot. So the tape measurement is kind of important. Yes, that's what we use it. But we try to combine it with the 3D imaging just because we think that that is more accurate because it gives you the specific measurements all the time in the same area, so in the same spot. So
Yeah, I agree. There's so many, and we didn't do many tape measurements, right? We didn't measure like every 4 centimeters. We measured, I think, every 10 centimeters, and that adds another level of inaccuracy. So we didn't see significant improvements with tape measures after using the pump, but we did with the 3D imaging, which I think is exciting. And we showed a change in fluid in the limbs, and that is the most exciting thing to me because again, going back to, there are people that say that there's no edema in lipedema, but I think we need to understand where the edema is. And I think this study gives us, gives more data to show that there is edema and lipedema. It's just different. It's different than lymphedema. It's in that extracellular space, but it's also in the intracellular space as well. And I don't think that's ever been shown before, right? For any study, in lipedema. So that's super exciting. And I just think that the study exceeded our expectations. Just the data was just so incredible. But you mentioned one thing, Carlos, and you mentioned that there was a decrease in volume only of the left leg in the treatment group, right?
yes,
Why,
that's
why,
basically
why is that? What happened with that right leg?
so well, I don't know, Dr. Lindy, if you want to take this when you mentioned because Dr. Lindy has been like more involved with like working with veins and working with May Turner. So I
Yeah.
probably want to explain a little bit more about May Turner and
Yeah, I'll take that one. So Karen, we noticed that there was a decrease in the volume of the left leg. And then we thought, and that was in the patients with the pump. And then after you and I were talking, we decided to, well, what about the controls as well? What if we looked at the volume of all of these patients together? And indeed, we found that the controls, the patients with compression only, and the treatment group, the ones with compression and the pump, actually had a decrease in the left leg. And one of the things that we got excited about was because it actually confirmed a finding that Dr. Steve Dean found. He's at the Cleveland Clinic, and he found when he looked at like 400 patients with lymphedema, and they had lipedema as well, he also found that the lymphedema was actually worse in the left leg than it was in the right leg. And we don't have a cause and effect, but what we're presuming as a possible explanation is that patients could have May-Thurner syndrome, which is a compression syndrome that preferentially causes swelling and other sequela in the left leg. So that's sort of what we're starting to speculate about that.
Yeah, and Steve Dean's paper was very powerful. And I think it was Deborah who actually reminded us. She was like, I found this paper by Steve Dean. Look at the left legs. And I think other people have shown that. But I think what he really showed, which is just amazing, is that it doesn't matter what kind of lymphedema you have. You can have primary lymphedema, secondary lymphedema, lipedema, lymphedema, obesity-induced lymphedema. The left leg is always worse. And we, in our clinic, we have a sozo as well. And we watch our patients go through and we can see the amount of fluid in the left leg is always more than the right. The risk for lymphedema in the left leg is always worse than the right. So I think that's a fascinating outcome from the study. And I think there are a lot of patients who say, like, my left side's worse than my right. Some say their right is worse than their left. I've heard that, but most of the time it's their left is worse than their right. So that was really fascinating. Marianne, so in this study, we enrolled primarily patients who had type 2 lipedema. I think there are a couple women or stage 2. There are a couple women with stage 3. Why was the enrollment done that way? And how come we didn't look at women with stage 1 lipedema?
I think that the reason, if correct me if I'm wrong, Lindy, is that the symptoms and the findings would be weren't as significant, and therefore it would be harder to prove, or we didn't know, we just didn't know. But knowing for sure that the data would be more theoretically thinking that the data would be more impressive with stage 2 and 3, because sometimes the ones are, just sort of borderline. So I
Yeah.
think that's a good decision.
Yeah, and if you don't mind me adding, we're also a vein clinic, and we see vein patients and who have tired, achy, heavy legs. And we do see some stage 1s in the clinic. However, usually the symptoms in lipedema get progressively worse as their stage gets worse. And sometimes the stage 1 lipedema patients, although they usually have venous reflux and venous disease, it just doesn't, like Marianne said, their symptoms aren't severe enough or bothersome enough to actually warrant a vein treatment. So that sort of supports what Marianne was saying. We were trying so hard to isolate lipedema, and if they had venous disease, to make sure their venous disease was treated. So we weren't looking at venous disease as a component, and we didn't have enough stage 1s who were symptomatic enough to actually usually get their veins treated yet. And that's most likely why, like Marianne said, just the progression of the typical progression of the symptoms, that we didn't have as many stage 1s, because we just don't treat that many veins in stage 1.
That's a really good point, is that you have to think about the context in which these patients were recruited, and you are in a vein clinic, and
Right.
there are fewer women with stage 1 lipedema that are going to have advanced vein disease, because they tend to be younger, right? That doesn't mean that there isn't lipedema and swelling in women with stage 1 lipedema. In fact, Eva Sevick and John Rasmussen's group showed that the lymphatic vessels are kind of enlarged, and lymphatic fluid pools in those lymphatic vessels, but those lymphatic vessels are pumping as hard as they possibly can to get that fluid out of the interstitial space in stage 1. So we do know that there is a lot of pathophysiology going on with stage 1. It's just that we use patients from your clinic.
Yeah.
And what was the diagnostic criteria that you used to define these patients as having lipedema?
Yeah, that is a very good question. We use the standard criteria that has pretty much been used in all the previous studies, and that was the criteria from the Wald study, and just using the standard stage 1, 2, and 3 stages. And so Marianne, I would initially had diagnosed them, and Marianne confirmed. So we had 2 physicians confirming the diagnosis in this study.
Nice. So far, what we've talked about is we have a study that came out of a vein clinic. Most of these women had vein disease that was already treated, so we could take that out of the equation. They're primarily stage 2 and a few stage 3. The treatment group that underwent the LymphaPress pump for a month, and they used the LymphaPants, so they were treating the legs and the abdomen. They had a nice reduction in volume by 3D imaging. They had a decrease in total body water, a decrease in extracellular fluid and intracellular fluid. And then we should probably talk about the fat. So we decided to ultrasound the fat before and after the pump, and this hadn't been done before. And we were looking at depth primarily, did the depth of the fat stay the same? And I didn't really know the answer. And I don't know if you guys knew, thought what the answer could be, but I thought what we were going to see is a change in the quality of the tissue, that we might see cleaner fascia lines, maybe less fibrosis. And actually we have not, there's a question that says, it's asking about fibrosis in the tissue. I think I saw that somewhere. Like, did the fibrosis in the tissue change, or was there fibrosis? And I wish we had Tatiana here, who is the main ultrasonographer, but we haven't really processed through the fibrotic data yet. And we did a couple of other interesting things, but one of the things that we found was a decrease in the size or the depth of the fat tissue after using the LymphaPress pump. Is that correct?
Yeah, we did. We found it in on the patients who were using the pump. We found it in the anterior thigh, the medial thigh, and the posterior calf. So in 3 locations of the leg, we saw an improvement in the actual tissue depth. We didn't see it in the lateral thigh. We suspect that's because there's not a lot of tissue in the lateral thigh. There's the fascia lata out there, and I think that's the reason. And we also did not see it in the around the knee and
Under the knee. Yeah, we
under
saw it
the
on the
knee.
medial knee, that
Medial,
terrible
yeah.
medial knee fat pad went down, but not under the knee.
And we suspect it's just the fibrosis because of the constant activity of the knee. Although one thing that we were really surprised about is in the control group, just wearing the compression only, they actually saw an increase in the tissue depth in the medial thigh, which was a real surprise because we weren't really looking specifically for that. We were looking more for, decreases or the same. So that was a bit of a surprise.
What do you think are we've got a great question from Karen Ashforth. Why do we think that the fat decreased after using the LymphaPress pump? Did something move out of the tissue, or do we just squeeze it down, or what was it? What do you think?
I think it's all that volume we were moving out. It was all that tissue fluid we were moving out. I think that was most of it. It could be that there were some inflammatory mediators that were also being moved out that maybe could be holding on to fluid. I don't think there was enough time to have any structural changes to the tissue. So I suspect it probably was more about actually moving the fluid and maybe the inflammation. I suspect with the control group, the only thing I can think about is that their compression was really good about moving it out of the lower leg, and maybe that fluid was accumulating in the thigh with compression, because we know that the compression's only 40% of the overall compression value at the thigh. So it may be just have been accumulating there. Maybe that's why it enlarged there.
So I think one of the things that we were thinking about, and we haven't done the research yet, but we are setting up a collaboration to do just this, is that in that interstitial space, there are glycosaminoglycans which bind up the water. So along with fluid moving out of the tissue, which I'm sure has to be part of it, that perhaps some of those glycosaminoglycans were also leaving the tissue. And your team collected tissue biopsy samples before and after. You collected blood before and after, so we could look in the biopsy samples, we could look in the blood, and you also collected urine, so we could look at glycosaminoglycan metabolites. So that's pretty exciting. And hopefully the team that we're collaborating with will agree and send us a material transfer agreement and take all those samples off your hands and find out, because I think there aren't enough studies of that have body tissue samples before and after a treatment protocol. And this is just such a great opportunity to learn more about lipedema, and also to see how important pressure is. And we also propose that maybe you know, if you squeeze a fat cell, the connective tissue in the fat cell realizes it's being squished, and it can actually transform back into a mesenchymal cell, which is a smaller cell. So, you know, it could be a decrease in cell size, and maybe the fat cells were losing some fat as well. Fat was coming out due to the pressure. And there are a lot of pores that fat can come out of in a fat cell, but you know, it also could just be fat coming out of muscle. So we don't know the exact answer to that, but we do know that the fat did decrease in size, and it would have been nice to have a DEXA scan too, wouldn't it, before and after, to actually quantitate that fat.
Yes,
But
I
maybe
think
next
that by combining the results from the SOSO, which is telling us that patients who were on the treatment group, they have a reduction in extracellular and intracellular fluid, plus seeing the reduction on the ultrasound results. That basically, you know, that combine of results is giving us like really good data and telling us that patients who wear the pump, they do have benefits.
Absolutely. And we did ask them questions, just qualitative questions on whether they felt better. And it was hands down wildly positive in the treatment group. Do you want to talk about that, Carlos?
Oh, yes. So basically, we were interested in knowing the quality of life of patients and see if patients had improvement on their daily activities and also on their symptoms like pain, achy, tenderness. So we did a couple of questions. One was the visual analog scale, which is basic. This basically tells us if the patient had an improvement on the pain and tenderness and achiness of the legs, and we saw a really good improvement of this. These patients who did the pump, they had a really good outcome on this test. We also did the um, RAND 36 and the LEFS, which are basically being used in different studies to tell us if the patients have improvement on quality of life. And we saw an improvement on patients who were on the treatment group. With patients who were under control, we have like no change on those.
Yeah, I think the questions we asked them for both the right and left leg were, do you have tenderness, aching, throbbing, burning, stinging, tired, heavy, swelling, tightness, difficulty walking, and easy bruising? And actually the control group did have a significant improvement in their swelling and tightness, which I think we ascribed to the fact that they wear compression garments. So I think compression garments are important for women with lipedema, but the treatment group basically had a dramatic improvement in all of those values, every single one with very significant p-values. And it was just, the table looks like somebody made it up. It's just incredible. And then you mentioned the SF36, which is a pretty standard, not my favorite, but well-used quality of life measure. And in the women with in the control group who wore the compression garments, they had a significant improvement in physical function, in pain, and in their general health. And then in the treatment group, they had improvements in pretty much so everything: energy, social function, pain, general health, emotional well-being, physical function, etc. So again, I think the study was beautiful and that it showed that compression garments too are important for women with lipedema. And if you're fighting with your insurance company to get compression garments, this would be a good study to use because it's showing the benefit. And then if you are having trouble getting a pump, this again would be another good study in saying, I wear my compression garments, but I'm still having some issues. I think I need a pump because of this study. So I think this study provides a useful tool for women with lipedema to prove that they need this conservative treatment to improve their quality of life for a variety of different reasons. And then the unusual part of the study was the reduction in fat tissue, in my opinion. I don't think a lot of people would have thought of doing something like that. So there were a couple other things that we did in the study I think we should mention. And one of we did some physical function measures. And again, this was only 1 month of treatment, so a very short period of time. And we actually took them off any kind of pump and any kind of manual therapy for a month prior to that. So we call that a washout. So they're off everything and then they go on treatment for a month. And we tried to look at improvements in physical function. Does anyone want to talk about that?
Well, yeah, I'm happy to. So we did look at the lower extremity function scale, which is another well-tested scale on functionality, and it looks at the ability to do their daily activities like getting in and out of a car, walking upstairs, get in and out of a bathtub, putting on their socks and shoes. So we looked at that, and once again, we had phenomenal results that the treatment group was able to better perform their true activities of daily living with the use of the pump. And it was statistically significant. So it showed not only are their symptoms better, not only is their quality of life better, but their actual true ability to function in their daily life with daily activities improved.
Awesome. So I'm going to go to some of the questions because some of these are like really good. So one of the questions is from Marilyn Lee. It is my understanding that insurance generally doesn't cover ICPs or pumps for lipedema. Any change expected given the results of the study? I don't know, Deborah, do you want to say something to that?
Well, I really hope so. Like you said, Dr. Herbst, it's the way that the study was designed. We had the patients do the 4 weeks of the compression garment, and then we added the pump for half of the patients for the treatment group on top of the compression garment. So both groups, the treatment and the control, started out with 4 weeks of the legging only, the 20 to 30 millimeter mercury legging. It was very nice legging, wonderful compression garment, and everybody said that it was very comfortable. And then we added the pump to that. So you can really see an insurance company or anybody who reads the study in depth can really see how the pump contributed to better symptom control, contributed to edema reduction, reduce the risk of lymphedema developing in these patients, and also a lot of the reduced pain significantly, which is really a symptom that really bothers patients with lipedema and doesn't necessarily is not necessarily well controlled just with the static compression garments. You need that pneumatic compression really to mobilize the fluid and to give that pain relief. And also a lot of the other quality of life results that we got. So all this together, I think it shows a timeline. You get the compression. If that helps you enough, fine. If not, then you add the pump to it. And it pretty much lays out the results that we got. So I think, yes, it will help a lot. And of course, we have a great staff of people at LymphaPress to help you navigate the insurance process and with the whole variety of insurance companies that are out there, and each company does things a little bit differently. Each company has their own different rules. So we are like the experts in that, and we'll help you with that.
I had to
Here-
jump in, Dr. Herbst, because I
Yeah.
agree. And my heart leapt when I heard your question, Marilyn. And while maybe years ago it was not so much of a slam dunk, we have great success getting this therapy covered because of the expert team that Deborah just talked about. So don't talk yourself out of it. If you're not using a pneumatic compression pump, please contact LymphaPress, lymphapress.com. We will connect you with a local representative and they will work with your doctor to get the necessary documentation and get you the therapy you need, because we're rooting for you. Sorry, I had to interrupt with that little
That's-
commercial, but
That is okay.
Marilyn, we want you to get a pump.
So, right, I'm going to go back to you, Deborah, just because here's another question from Susan Mullins. So, how would we recommend getting a patient a compression garment for a pump garment for the trunk and not just leg sleeves? What words do we use to document for insurance coverage of a pump that's treating the trunk as well as the legs?
Well, the insurance companies do want to see trunkal edema. So the whole idea of the trunkal garment is that it treats edema on the trunk. So you have to demonstrate a trunkal edema. There's various different ways of doing that. Circumferential measurements. You can do pre and post treatment measurements to see the reduction of edema to show that it actually is edema fluid and not just fat tissue. Pitting, doing measurements with calipers. These are all great ways to be able to ascertain how much trunkal edema there is and where it is, and to provide very specific documentation of the location of the edema and the measures that you took is going to be very important.
And then just for the study, Deborah, I'm kind of really bombarding you, but how much time how often did they use the pump, and what pressure did they use? What kind of pressure settings for the LymphaPress?
Sure. So we were encouraging patients to use it every day. If they could do it once a day, that's fine. We also encourage them to do it twice a day, to fit it into their daily routine before they put on their compression leggings in the morning, and then when they retired at night, when they removed their compression leggings, when they were getting ready to go to bed, to use it again. They used it for 60 minutes each time, and at 45 millimeters of mercury. We have different cycle options depending on the patient's the way they feel. And some patients prefer to do the sequential cycle, which is very, very effective. And some patients chose to use the wave cycle, which has a distal release, which feels more like a manual massage. And it's also effective, and it may make the treatment a little bit more comfortable for some of the patients who have pain issues with their lipedema.
Lindy, there's a question about what type of compression the women wore. Could you tell us?
Oh, Carlos, you ordered those. It's a legging, and it is a 20 to 30 legging. I can't remember the exact brand of it, but
Yeah.
every single patient, Carlos will remember, every single patient was given 3 pair of size appropriate legging for the study. So every single control and treatment wore the exact same legging throughout the entire study.
Yes. That was one of the things that basically we encouraged the patients at the first visit, and we wanted.
Absolute support. Sorry, absolute support
That is
legging.
correct. It's
20 to
absolute support.
30.
That is the brand of the, yes, that is the brand of the. So we tried to select the patients with this type of like inclusion criteria, telling them that they will need to wear the compressions, that they will need to basically stop any other type of therapies that they were doing, and also to have um like a consistent weight or diet, just because we wanted to see like good and real results. So compressions, diets, therapies, all those things were the ones that we decided to include whenever we're like including or excluding patients.
Thank you so much. All right, so there's some thoughts, a couple of questions on like if you use a pump for a long period of time and then you stop using it, will you rebound? Will your like you suddenly start to swell and your fat tissue will grow again if you stop using the pump. Anyone have any thoughts on that one?
I suspect that it will probably slowly reaccumulate. It seems to be what we see in our clinic when we're doing vein treatments. We ask the patients to stop using their pump for about a week, for a week after each treatment, because of the vein treatment. And they do seem to accumulate, and they're having this fullness in their leg. They can't wait to get back on their pump. So I think there is an accumulation. And the way I like patients to think about it, it's like holding back the tide. I tell them we've got to push gravity, and we're going to push back the tide with the pump, and we're going to hold it there, but it's going to roll back in if we don't consistently have something working against gravity, like the pushing toothpaste out of a tube to push it up against gravity, up out of the legs and out of the pelvis and back into the circulation, so their kidneys can process the fluid and they can void it out.
So when there's a couple questions on when you should use a pump. Should you use a pump in the morning? Should you use a pump at night? And how long should you use your pump every day?
I get that question a lot. And my first response is use it when you can, because a lot of patients, their lifestyles they can't do it in the morning, they can't do it at night, or they can, or they can't. I said, just use the pump. We want you to use the pump. Find a way that you can incorporate it into your life, number one. Personally, I think probably morning might be better in some patients and evening might be better in others. I don't think that there is a definitive answer. They're going to be wearing compression the whole time, but I just think it's better to use it. Don't leave it in the box. It doesn't work in the box. You have to use it. The other thing is that some patients don't have an hour each day to use it. And I'm like, well, if you can use it 15, 20, 30, any is better than none. So I just encourage patients to use it as much as they can, when they can, in their lifestyles.
So I just want to summarize. So for people who have a pump and compression at home, if you do stop using it, the fluid is going to slowly collect back in the tissue. It's not going to be an immediate gush or rush, but the fluid's coming from somewhere, and the literature suggests that there are leaky vessels, right? At least that's part of the pathophysiology. So until we stop the vessel leak, we got to figure out why they're leaking. We're going to need compression. We're going to need pumps. We're going to need manual therapies. We're going to need exercise, and we're going to need anti-inflammatory eating plans. But I don't think I don't think you can cure lipedema using a pump and compression garments. If that were true, that would be amazing, but it's just not. So we need to, again, find out the pathophysiology about lipedema. And I think the study actually helps us get a few hints about what's going on, that there's some intracellular fluid that we didn't consider before, that you can press the fat and teach it to become smaller. So I think those are all, there's some good positive things coming out, and there's so much more data from the study that we can pursue, and we're going to pursue, that I think will get us even keener insights onto the pathophysiology. Someone was asking, and I think, Lindy, you mentioned it, you talked about the kidneys. Is the fluid only released from the body via urination, and how long does that take after you pump?
Well, from what I've heard from my patient, it doesn't take very long. Some of them can't get out of the pants fast enough to go to the bathroom. So it is mobilizing this fluid fairly rapidly back into their circulation. Their heart is pumping it in their circulation to their kidneys. Their kidneys are filtering it. And these women are voiding this fluid out. So it is actually happening pretty rapidly, because they will have to go to the bathroom and urinate very soon, literally sometimes within 10 to 20 minutes after pumping.
One of the things I like about the the LymphaPress LymphaPants is that they are a zipper and they're easy in, easy out. And so I think, and correct me if I'm wrong, Deborah, but you could, if you had to go to the bathroom in the middle of a pump session, you could stop the pump,
Oh,
unzip,
sure. You just
go
press
to,
stop and you unzip and you get out, you go to the bathroom, you come back and it's all good. It's very easy to get it. It's very easy to get in and out. And I think, like the where you I think we see this more in the initial sessions. So when you're carrying a lot of fluid, then you may have to stop in the middle of treatment. But after a while, when you do your maintenance with it, then you probably won't have to stop in the middle and run to go to the bathroom. Yeah.
so yeah, so one of the questions is, how does pumping compare to self-manual lymphatic drainage and professional manual lymphatic drainage? And I think I'm going to answer just a little part of this and then let you take the rest. But one of the most important reasons to have a pump like the LymphaPress at home is that you can't go to manual lymphatic drainage therapy every day. And insurance companies sometimes only pay for a certain number of sessions, which you really want to, use to your greatest benefit. But you can use that LymphaPress pump at home every single day. So it empowers you to take care of yourself at home without depending on a professional, without, having to go drive somewhere. But Deborah, what would you say? How does it compare to self MLD or professional
Sure.
MLD?
Sure. I mean, professional MLD is wonderful. Self MLD is wonderful if people will do it. A lot of times it's, that it's something that you got to do. It's something that you have to motivate yourself to do. Whereas being in the pump is very passive. You just get in, you can watch TV, you can listen to music, whatever. You don't have to be doing something yourself. So in that way, it's very efficient. It's very consistent. But more important than that, because I know you're all going to be consistent anyway, whatever modality it is that you're going to do, and you're all going to be compliant. But there's a difference between MLD and the LymphaPress. The MLD is going to stimulate your lymphatic system, but it's not going to do the compression. LymphaPress is going to stimulate your lymphatic system to pump faster and absorb lymphatic fluid more efficiently, but it's also going to do the compression. And so that's the missing link here, really. Manual lymph drainage isn't usually done by itself. It usually do bandaging, which is a wonderful modality for reducing edema, lymphatic bandaging, but it needs to be applied by a professional. And as Dr. Herbst said, you're going to run out of clinic sessions eventually, and you won't be able to do it. And bandaging is not a DIY thing. There are some bandage substitutes, but real lymphatic bandaging is something that a therapist does for you. So the LymphaPress is going to do that massage component to stimulate your lymphatic system, but also do the compression. And it's a dynamic compression. That's the difference between it and the compression garment that you're wearing. It's going to actually move and in a sequence to help move that fluid to healthier lymphatics. So that's how the LymphaPress works, and that's why I think it's different. There's all sorts of different modalities out there, so it's like two things in one. You're getting that massage and that lymphatic stimulation, but you're also getting that dynamic compression.
Perfect. Marianne, did the patients wear compression each day, and how long did they wear it in the study?
Far as what I would explain to them, I mean, from literally when they were getting dressed, they put on their compression hose. And then, of course, if they were showering, they weren't wearing when they were showering or this or that, but we encouraged them to wear it all day long. Yeah.
Awesome. Anything else? I think we should go around and just say, anything else you want to add about the study? Lindy, do you have any other thoughts on what we
I
found
just
out?
want to add something real quick about the pneumatic pump. The beauty of it, of having it at home, is that
Sure.
depending on the days that the patient had, like if a patient had a really tough day where it had a lot of swelling, probably it was riding in a car for more than 2 or 3 hours, or just being standing for a long period of time. So I really encourage the patient to wear the compression. I'm sorry, to wear the pump that day at the end of the day, just because having that swelling on their legs will create more inflammation, and this inflammation will predispose to have uh, like more pain, like more creating more fibrosis. So basically, we don't want to have that swelling on that leg, just because that will predispose to be like causing more tissue damage, like more lymphatic damage. So it's really important to, whenever the patient feels that they've been having like a really hard day and they have like too much swelling, just by the end of the day before going to bed, or wear the pump. That will help a lot to reduce the risk of creating more inflammation.
Just make sure you leave enough time to go to the bathroom before you go to bed, because it will move your fluid out and through the kidneys into the urine. So Lindy, do you have anything else you want
Yeah,
to?
well, what I would say was something we were just talking about is I'm a big advocate of manual lymphatic drainage. I think that that has been well proven to improve all sorts of things. And the manual lymphatic therapists are such great educators for the patient and advocates for the patient. The one thing about the pump is there are lots of patients who work Monday to Friday, 9 to 5, and they can't get off of work to go get the manual lymphatic drainage. If there was someone in their area, there are many, many areas where patients don't have access to an MLD therapist, even if their insurance covered it. So this is sort of using this pump fills a great void that some of the patients just will be able to get the lymphatic drainage at home when they don't have access to MLD therapist.
Mhm. Marianne, do you want to add anything?
Yeah, I just want to give a shout out to if any patients are listening and thank them, the volunteers coming in for the study. They put a lot of time into it. They had to get up early. Some of them drove up quite a distance for all of the clinic visits. And they were just so excited that there was any research being done on lipedema, and so I'm sure thrilled now that the paper's getting published, that we're learning things. I just want to thank the patients, because if they hadn't come in and weren't as loyal as they were to the study, it wouldn't have happened.
That's a really good point. I think that the women in the lipedema community are just amazing advocates for themselves and for others. And I have never had any problems recruiting women with lipedema into studies, because they want to help. They want to be part of the answer. And that's what has made working in this field so rewarding, is because we are all part of the group. We are all working together for the same thing, and that's just so exciting. Deborah, do you want to add anything?
Just was really so grateful to be part of this experience, even though I was like a fly on the wall for most of it. And so, and really, it was just wonderful to meet all of you. And again, thanks to the patients who participated. They were really wonderful. And coming in, driving really long, like you said, some of them came really far away to participate.
There's one last question. We have 2 minutes. I know Brenda's coming on, but one of the questions is, any info about using the vibration plate 10 to 15 minutes before the LymphoPress? I think that's a great idea. The vibration plate builds muscle, bone, moves blood and lymph fluid, and it might over time decrease fat, but I don't think there's a good study showing that. But could that loosen up some of that glycosaminoglycan gel and then allow the LymphoPress pump to pump it out? And that's something I've recommended in the past. Anyone else agree that that might be a good idea?
Absolutely, yes. Just like you said, like breaking up that glycosaminoglycan and then be able like to use the pump to move it out. That would be like a great combination of therapy. So, um, I always tell the patients the more we do, the better it is. I know it's so hard, just like managing the time to do a lot of things is so hard, but every time that you can do it, just do it. Okay, remember always that. Okay, the more the better.
Thank you. Brenda?
I want to say, and I'm collectively applauding with everybody in the audience, this was a riveting hour. We're so appreciative of the research, your leadership, Dr. Herbst, Dr. McHutchison, Carlos, Marianne, Deborah, thanks for being here tonight. And to our chatters and our audience, heart bows to you. You were
Yeah, that
awesome. There were so many good questions and such great chat. We're glad that you logged on. We're so proud at LymphaPress to offer therapy that's easy to live with, that brings hope and help to people, and connection and opportunities for us to connect like this. So thank you for being here, and bring that study into your position to, this study, it has legs, literally, and it's going to go on and on and on and have great impact. And we're so proud to be a part of it. Have a great night, everyone. We'll see you next.
And it's free. You can get it free on the internet.
Yep. Grab it right from the link I put in chat. We'll see you next month, everybody. Have a great night.
Thank you.